Can you think of anything in society, anything going on around you that's more important than your health and the health of your family? No, this is not an ad for vitamins. I'm serious. The US healthcare system and the medical education system is very much largely controlled and directed by big government, big corporations, big insurance companies, and big pharmaceutical companies that don't have your best interests in mind quite often when they make decisions about policies that affect you. Doctors are burning out faster than ever, and if we don't do something about it, there's going to be a big shortage within less than a decade. But it doesn't have to be that way. It often feels like there is no way out and that you have to just go along with this. But it doesn't have to be that way. It hasn't always been that way in the past. It doesn't have to be that way in the future. I'm so excited to be able to talk with Richard Walker, the Executive Director of the Benjamin Rush Institute. We are talking all about healthcare, how it affects you, how it affects our doctors, how it affects your pocketbook. You do not want to miss this interview. Thanks for tuning in. This is the Today with Kay show, and I'm Kay Rubacek. How is your coffee supply? Is your coffee really 100% organic and roasted right here in the US? Well, Freedom First Coffee is. It's a gourmet coffee roasted in Victorian-era roasters in the heartland of the USA. Their tagline is, "Tastes like freedom." I do not know what freedom flavor exactly really is, but I can say it tastes great. I drink it myself. I would like to invite you to give it a try. Go to freedomfirstcoffee.com. That's freedomfirstcoffee.com. Use the promo code K, K-A-Y, for a discount. And that will also support this show. I like to say we vote with our dollars, so buying your coffee from Freedom First Coffee is a delicious way to vote for freedom. And if you already have your own favorite coffee supply, don't worry, because you can buy me a coffee. Go to my website, kayrubacek.com. That's KAYRUBACEK.com. And there you can actually download my latest book for free. It's called Nowhere Left to Run, 10 Steps to Survive Tyranny Today. I wanted to put that out for free, and that's why I added the Coffee with Kay button, where you can buy me a virtual coffee to help me keep being able to put out more content like this. I appreciate you all for all the support that you've given me and all the encouragement. It helps me keep going, and I hope that I can do the same for you too. Richard, I'm so glad that you're joining me here today because as I very much agree with the statement that you have on your website, it says no public policy issue impacts American lives more profoundly than healthcare. And I have to say, I absolutely agree. But your website also says, and I'm quoting here, you promote healthcare freedom and preserve the sanctity of a direct patient-doctor relationship. What do you actually mean by that?
Well, first of all, healthcare is important, if only because it's about a third, give or take, of the entire gross domestic product of America.
I didn't know
and
that.
it is not like that in some other countries, which have also good healthcare systems. But we feel like America has the primary healthcare system, the number one healthcare system in the world, but it is also a very expensive healthcare system. Now, as far as we're concerned, one way to reduce that cost, in fact, our entire mission statement is that we exist to protect and promote the doctor-patient relationship, and to promote that relationship as the primary means not only for greater access to higher quality care, but also it improves physician satisfaction, reduces cost, fosters innovation. One of the biggest problems we have right now is doctor burnout, physician burnout. They are literally leaving the profession in droves, and it's mostly due to the conditions under which they have to practice medicine, and they are not aware of that when they are in medical school. That's where the Benjamin Rush Institute comes in.
Right. Now, education seems to be a primary focus for you. Again, I'm quoting from your website here because I found this very interesting. Most medical students today are instructed overwhelmingly in healthcare policy that promotes a government centric approach to healthcare and rarely, if ever, encounter a voice promoting free markets and the sanctity of the patient doctor relationship. On some campuses, the government's role in healthcare is not even to be questioned. Now, I'm not surprised by learning that, but it does sound like a problem. And why is it such a problem, and what are you doing about it?
Well, the biggest problem that we have, and I think the biggest problem that confronts medical students, they are not, by and large, education, economics, public policy, political science majors in their undergraduate study. They're biology majors, biochemistry majors, chemistry majors, things like that. So they don't run into a lot of public policy. And there was a Harvard study done, it was a little bit pre COVID, that on average, a medical student in the United States, now that's 4 years, but that's before they go to their residency, only receive about 14 hours in public policy education or instruction. And that's if they get any at all. And by and large, that is not from a free enterprise perspective. In other words, meaning the doctor sets up the practice and runs it for the benefit of the patient. And that has been proven in study after study to yield the optimal patient outcomes. So our perspective is to come in and say, look, you don't know what's coming. You're not aware of what's coming. Yes, you'll get out of 4 years of medical school. You'll either have an MD or a DO degree, Doctor of Osteopathy, and you'll go into a residency. You'll match for a residency. Too many students don't, but still, by and large, students will match for a residency, and then they'll anywhere from 4 to 7 to maybe even longer years to become the physician that they wanted to become, like a radiologist or a rheumatologist or an OBGYN or something like that. And then they will get a good job making good money, but they don't realize how long they're going to have to work and how many hours they're going to have to work in order to make that kind of money. Plus, they're not going to be aware of the conditions under which they will have to work. Many times that's desktop medicine. The the big hospital they work for or the insurance company they have to work with will basically dictate to them how they are going to practice medicine.
You mentioned a term. Am I getting it right? Desktop practice. Is that what you
Right.
said? So
Computerized medicine, where they're basically typing all the time. They come in. I don't know if you see this that often. I do. I hear about it a lot, where the doctor will come in and literally has their laptop in their hand. Uh, Maybe they say hi. That's about the only time there's an interaction there between the doctor and the patient, and they're typing all the time. And everything they do is subject to review by the third party, whether it's an insurance company, the hospital, a big insurance company. It could be a pharmaceutical manufacturers. A lot of the pharmaceutical manufacturers, or some of them, and some of the big hospitals are actually the ones that own many medical schools. So therefore, you have a lot of faculty and that are in favor of a single payer or socialized medicine system. The problem with that we have is that we're not welcome on campus in many cases. If a group of medical students wants to start a club with the Benjamin Rush Institute, that gets to be a very, very difficult proposition. And there's a couple of three problems. One, the faculty will either be what is being called fully woke. They're all behind single payer insurance. Then there are those who understand that, yeah, we really would like to get back to the traditional way of practicing medicine, empowered by a robust free enterprise system that has worked over centuries as a social compact between the patient and his or her doctor. So you get but they're afraid to say anything because the environment on campus, the milieu on campus is so oppressive. Then there are other, and these are the really disappointing ones, there are other faculty members who say, look, I agree with you guys. I really wish we could get back to doing this the way we used to do it before the insurance companies and the pharmaceutical manufacturers got so involved. But single payer probably is the way this is going to go. If that's the case, am I doing my students any favor by not getting them ready for that? That's just that's very disappointing. Now, really good story. We just got through sponsoring 5 students. One of our programs is a conference scholarship program. We paid all the expenses for 5 students to fly in, put them up, fed them, everything, to go to this conference, and to see the light come on and the brightness in their faces about, oh my gosh, this is the way I want to practice medicine, because they're with all these DPC doctors, so on and so forth. Kind of makes it worthwhile. Just kind of makes it worthwhile.
Well, I'm glad you shared that, because it was, when you talk about what's going on in the colleges and the challenges that you have there of actually telling medical students that there are alternatives to what they're being taught, and having that being prevented from you having access to just giving them that information can sound a little bit depressing, but hold on, friends, you are listening to an interview with the executive director of the Benjamin Rush Institute, Richard Walker. This is the Today with Kay show. Stay tuned. We have much more coming up just after this break. Gold, 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 gold. Have you heard that before? If you haven't been paying attention. We are heading into a recession. It is inevitable. It is a really serious financial crisis. Many people have known this is coming for a long time. The financial analysts who are finally actually talking about it are saying it's going to be a lot worse than they expected. They knew it was coming. Come on. But are you prepared? If you are not, it's not too late. If you want to use gold as a way to secure your assets, you need to talk to someone you can trust, someone who knows the financial industry. Don't talk to a podcaster like me. I know communism and socialism, and I know the economics of that, but I don't know how to invest in gold. You got to talk to an expert. I trust Ira at ourgoldguy.com. Do whatever you can to protect yourself for the upcoming financial crisis. You've got an idea of what's coming. No one knows exactly how bad it's going to be, but now is the time to prepare. Go to ourgoldguy.com, talk to Ira, and mention my name, Kay. What I really like about what you're saying, Richard, is that you're talking about really empowering the students, from what I'm understanding, medical students, which is therefore empowering the patients, which is the majority of us. And then I'm hoping that you're going to tell me that that's also empowering educators of the students, and that this will slowly, or maybe quickly, however long it takes, will have a long-lasting effect, positive effect, because as you're saying, we've got these people getting in the way, these entities. We've got government, we've got big pharmaceutical companies, these big corporations, and others that just want to prevent this direct patient care model. And you talk about free enterprise or free market. Can you explain what that is in terms of health?
Well, yeah, I mean, it keeps costs down, because just like if you're aware of health savings accounts and even flexible spending accounts and things like that that a lot of the healthcare plans are coming up with, in order to help employers provide more healthcare, because it's getting so expensive they can't do it. Well, when they go to these plans, they find that the employees, which are the patients or the prospective patients, they really enjoy spending their own money, So like for a health savings account, I make a contribution, or the person that holds the account makes the contribution every year. And that money that they contribute, they can spend as they wish, as long as it's for a healthcare related situation. So, for example, you may have maybe you have a hearing problem or something like that, and I don't. I have a heart problem or whatever, so I can spend my money on that. Or maybe I want to get new glasses or whatever. I can spend it the way I want to spend it, and we find that patients, or I should say the employees who become the patients, they are very, very much approving of the health savings account model, and even flexible spending accounts. They want to do that. So if you transfer that over to the direct primary care model, in that model, they take out a catastrophic policy so that everything above $10,000 is covered, and then they have to contribute that $10,000 or be able to cover that $10,000 deductible. But how that money gets spent is up to them. So that helps reduce costs because now they're having to make choices. They're having to be wise with their money. Otherwise, it's all the health care I get and I'll spend it till it's exhausted. In rural areas, there are insurers. I think Mitigate Partners out of Atlanta is a good one, but they are working with these rural hospitals, these small hospitals, that they get to the point where they just can't be viable anymore financially. So they're working with them to use direct primary care as the model there, and it absolutely is resuscitating and reviving the rural areas, healthcare in those rural areas. And as you know, a lot of these rural areas, there are a lot of elderly people there, so on and so forth, that they have no other options. Well, here comes direct primary care. Not only gives them more options, but it actually allows them to have more care because it's cheaper. And so we're beginning to wonder, will there be a groundswell here? And from the rural areas in, that is how healthcare in America gets reformed.
Wow, that is so encouraging to hear, this revival, reforming,
Well, let's
you
let,
know.
let's just keep hoping. let's we can hope, only hope, because the model we have as it is right now is, if it keeps getting more expensive and it keeps narrowing the choices of the patients and the doctors who treat them, then it's not sustainable in the long run. So we can hope, and it's working so far.
So what do you need for it to really be able to work, you think?
Sometimes I think we need a miracle, but I don't think that's going to be the case. I think as patients become more aware, as the current system becomes more and more unsustainable, these options will have to crop up. And indeed, direct primary care usually is when somebody's exhausted all options, or I don't know if I would say they can't live with what they have, but just they're looking around, they're scouting around for options. And by here, and what I'm referring to here, is employers who are so pinched. And you know, I guess one of the things that people often don't consider is that employers want their employees to be happy. And one of the ways they can make those employees happy and glad they're working where they're working is to provide at least some measure of health care for them that they don't have or they otherwise couldn't obtain. And one of the ways that employers are increasingly waking up to that they can do that is through these direct primary care options. The Free Market Medical Association's chapter down there in San Antonio, Texas, and this is not unique to them, but they are actually working with employers to have the employer hire the doctor
Ah.
and do that direct primary care model with their doctor. So when you go to work for, say, XYZ corporation, and maybe it's a smaller corporation, but you have that doctor and he or she is on site, and it's a direct primary care or a direct specialty care model. And so it's working in that way too. So we're seeing these little things happen, little piece here, little piece there, the rural into urban, so on and so forth. And slowly but surely, we hope this is going to be, or it is reforming, but we hope it's going to be the ultimate reform for what's wrong with the U.S. healthcare system.
Well, worst case scenario, Richard, what would happen if you weren't doing what you were doing, and all the others involved in what you're doing weren't doing this? Where would we end up?
It appears the most likely would be total single payer healthcare, Medicare for all, so on and so forth. And we would have the same problems that they have in Canada, that they have in the UK, probably have elsewhere where these systems exist, where if all that's wrong with you is your child has the flu or something like, not COVID, but just, little flu symptoms, they have summer cold or whatever, or they're, it's minor stuff, then but this is a great system. I mean, you go in, it's free. You get do just about whatever you want. Of course, the doctors are overworked, and underpaid, but you can get that done. However, if you have a bigger problem, like God forbid, one of your kids is born with spina bifida, or for the individual patient, all of a sudden, you're a man, you go to the a doctor, and you're in your 40s, and they say, look, this problem you're having, the symptoms you're having, you probably have prostate cancer or breast cancer for a woman or something like that. And they're not just life-threatening events, they are lifestyle events too, because it's like, well, this is not the person I am. I don't feel like I'm a whole person anymore. And so there's all kinds of things that have to be done. Plus, it's going to be extremely expensive. Then if they catch you, as in the case of Canada, they catch you creeping over the border to get all this done in America, or in somewhere in Minnesota or Montana or something like that, they're going to fine you, and that also adds up. It gets to the point where if you don't keep working and you don't keep a really, really platinum type insurance program, you can't save enough for retirement. You're going to go broke if any
You're going
kind
to
of
go broke.
adverse health event happens.
Right. You're going to go broke, and the doctors are going to get burned out. Absolutely. Or they're just not going to be able to provide. Just going to have to wait.
Well, here we are. We keep saying, and we've been saying for some years now, we have such a great shortage, or and an increasing shortage of doctors in America, and this is one of the things the direct primary care in the rural areas is helping solve. But we have such a flight from the profession that there's going to be such a shortage of doctors by 2030. Some say 60 to 70,000, some say 100,000, even more. So we're staring straight down the barrel, if you will, at this problem.
Exactly. Exactly. This is fundamental. This healthcare is something we all need and we have to pay attention to. Can you remind us the importance of Benjamin Rush?
Well, we chose Benjamin Rush as our mentor because of the role he played in the founding of America. He indeed is one of the founding fathers. He's a protege of Benjamin Franklin. Benjamin Franklin paid for him to go to Scotland and be trained in medicine. He came back to Philadelphia. Benjamin Franklin. He came back to Philadelphia to practice medicine, and had a very distinguished career. But his whole career, if you will, was scientific, employing the scientific method in medicine. I mean, stop and think. Back in the day when he practiced medicine, in the late 1700s, they were still, using leeches to bleed people and things like that. And he kept getting into, well, this scientific method, here's how we treat these things. So as we go forward, that is our emphasis. This is the science. We're not going to tell you. We are a service organization. We're not a political or even a public policy organization. We don't come in and say, I'm not a doctor, so we don't come in and say, here's how you ought to be thinking. What we do is, if you tell us, for example, you want to be a dermatologist, and your club on campus wants to talk to some folks that practice dermatology about what it's going to be like for you, what you have to do to prepare for that career, so on and so forth, we'll pay for that. We'll fly that person in if we have to, in order to meet with you. We want them to meet with other doctors. We're not a doctrinaire organization or a political organization. Our job is to make sure they understand. And of course, in this day and age of the way medicine, by and large, is being practiced in America, they don't know what's coming. They're not aware of it until they get there. So we have to try to get them before they graduate, so they'll know what's coming and they can prepare for it.
Preparing doctors to know what's coming. That sounds vitally important. And how do you prepare patients? Can you tell us, how can you prepare patients for what's coming, and what advice do you have for patients?
Well, what we do is a lot of social media, because patients don't form clubs out there in neighborhoods or whatever. If they do, we're not aware of it. But No, we try to do a lot of social media so they know. And of course, there are other organizations that do this too. The Doctor Patient Care Foundation does a lot. Free Market Medical Association does a lot to show that you can get the highest quality care, and it doesn't have to. It's not. It doesn't. It'll be a fraction of the cost of what you would pay through an insurance company. Just like right now, when they compare these prices, say for an MRI, if they go to 5 different sources, including some free enterprise sources, they find out that not only is the free enterprise price always by far the lowest price for the higher quality of care, but that there's a huge range. They can, for example, you go to get an MRI, that you can pay as little as $1,000 for some of them. Some of the hospitals or some of the organizations, it could be as high as 2 or 3,000. It varies that much. You look at the Surgery Center of Oklahoma, it's less than $1,000, sometimes $300, $400. That's all you need to pay. Got to get yourself to Oklahoma City to do it, but increasingly there are surgery centers and specialists, direct specialty care physicians that are operating practices all over.
So to me, it sounds like it's very promising, which is great. But I'm sure you're up against
Yeah,
challenges. You're up against a big system, establishment system, and corporations. So
right.
I wish you all the best and
Well, thank you.
in your endeavors. And can you just remind our listeners and viewers where they can find more information about you?
Well, for us, it's BenjaminRushInstitute.org. I'll even give you my phone number. It's 214-507-4610. They call me, I'll talk their arm off about this stuff. I love this stuff because I know and I can see not only from patients we hear from, but from the doctors we hear from who have finally, like the lady I was talking about that we interviewed earlier this month, that they actually have come back to medicine. And one thing that people should understand, and I think a lot of people look at it and say, oh, he or she went to medical school. They want to make a lot of money. Well, yeah, they want to be rewarded for the skills that they obtain. But I have found, at least in asking these students, the number one reason they go to medical school is they want to care for people. And they'll use phrases like the patients who will be under my care, or the community that'll be under my care, the people that I'm going to care for, things like that. And that is refreshing. That's real refreshing.
Oh, that's just wonderful. Thank you so much, Richard, for talking with me. And friends, you can't get more direct than that, can you? That is the executive director of the Benjamin Rush Institute, and he just gave you his phone number. You cannot get more direct than that. So wherever you are across the nation, you need good health. That's it, period. You know you need that. You know your family needs
Amen.
that. Your whole community needs that. And don't feel overwhelmed that it is impossible to get, because you are able to. You need to maybe make the effort to look into something that may seem alternative, but actually it's probably just a bit more traditional. If you are listening to this on a podcast, please click the 5-star review button, because that actually helps this show get heard and seen by more people. If you click a less than 5-star review, it's not going to actually do anything. It may actually cause more harm. So I'd prefer you don't give me a review at all, and I would never, ever be offended. I'm so glad that you've joined us for this episode. Click the like, share, subscribe, all that stuff, and help spread the word and get more people listening and sharing this positive information. Thank you again. You have been listening to the Today with Kay show. I'm Kay Rubacek, and I'll see you soon.